Because here we go. It's podcast time with Dr. Jenna and me. And we've already done our TikTok dance out in the hall.
We did it.
We should be using a little Taylor Swift because it was Shake It Off. It's what we did.
Oh, you mean we should have that as our entry?
Yeah, we should.
We should have done it. But we didn't think.
It's Doc Talk with Dr. Jenna Burton, coming to you from the Rove Hotel downtown Dubai's Epic Podcast Studio. I'm James Pikeway, and we're going to talk about eyes today. That's where we're going. Eyes.
We use them every day.
We use them every day.
We don't really think about them very much.
Not really. We have contact lenses. We get eye infections, not necessarily from the contact lenses.
Sometimes
we get dust in our eyes. We get things over and over again. I had a son who poked his eye with a fork.
Who?
My youngest.
Oh, goodness me.
You know when your kids are like 5 or 4 and they're eating and and they're doing all this and you're saying as parents, don't do it, you're gonna poke your eye out. He did poke his eye.
Wow, I take it he was okay after and there was no residual damage.
He poked into the white, thankfully, and there was no nerve damage, there was no anything, because we then took him to there was a little bit of a mark and whatever that part of the eye that's called, but took him in and said, you're so lucky. If he'd just been over a little bit more, it would have been a whole different story.
Yeah, you got all your sclera and that there.
Yeah.
But the thing is that you can get infected when you have a foreign body go into the eye. So usually you give antibiotic drops them to go home
and I'm sure that's what we had. And
check nothing's left in the eye.
Oh man, it was horrible.
Well, don't forget the eye, like every other organ of the body, is still protected.
Yeah.
So, it's like if you hurt your skin, we have bleeding and we have layers of skin. That our eye has got membranes that covers it to try and protect it from things like this, because they're quite vulnerable, aren't they?
They are. And you wear contacts?
No, I had laser treatment on my eye. Years and years and years ago.
It's all been good.
Yeah, so I
hold on, you just said,
Well, so I had it done 10 years ago.
10 years, that's a long time. That's first gen laser.
It was first generation laser, but I was almost blind. I was really had a very high prescription to my glasses and my contacts. And I found that I suffered with really dry eyes.
Okay.
So
what did you, just lots of eye drops?
So lots of eye drops, but if you suffer with dry eyes, often what you find is you get repeated infections. So contact lenses, dry eyes, therefore lovely harbouring ground for repeated infections. And then I'd have to wear my glasses, and that was the issue. You and my mum are people that love wearing glasses.
I love glasses. I mean,
you rock them, James.
And I work sort of the opposite. I mean, I need them for reading now, but it's really for the far distance that I need the glasses.
That's age. Often that happens with age.
And so I never really fit into the bracket to go and get laser. Like say, you can get laser, and it's like, you don't qualify, sir. It's like, okay, that's good because I don't want it anyway. But I was just curious.
Well, yeah, and it changes your vision, or maybe first generation laser does. First of all, it can make your eyes drier. So I suffered really bad with dry eyes.
Really? Like what? But why would it make your eyes drier? Because it's lasering the top, not your tear ducts and all that stuff.
I have no idea why it makes the eyes drier, but it does. And as I say, this is years ago. Whether it still makes the eyes drier, I'm not sure. But it certainly did back then. It was something they really counselled you about, the fact that you were going to suffer with dry eyes.
Forever?
Yeah, and especially if you've had a problem with dry eyes. So I'd already had lacrimal plugs put in, which is where they put this little tiny plug.
Say that again.
Lacrimal plugs.
Lacrimal plugs.
So you have...
Sounds like something out of Star Trek. Get the lacrimal plugs out.
Well, the lacrimal plugs were put into the lacrimal gland because...
What's this? I've never even heard of this gland. Like, why are you dropping a new name on me like this? Lacrimal glands.
Okay, so
where's that?
Right. In your eye, it creates water, right? You need water for lubrication of the eye to protect it against infection.
And our eyes are pretty wet, actually.
Yeah, they are. Yeah. They are wet. Like, we wouldn't be able to blink properly. It would feel gritty, and we'd get stuff stuck in it a lot more regularly, like sand particles, because there'd be nothing to help flush it away. So then we have these little glands. I actually think there are 2 glands, but the main ones are here, just at the front, so the anterior.
So this is really good if you're watching on a YouTube video.
Portion of the lower eyelid. Yeah. So that is basically on the bottom and in the middle of the eye.
Is that like the little bump we see? If you look really closely, you kind of see a little bumpy thing.
Yeah, it is actually, because that's where basically we drain away our tears. We drain away the fluid in our eye to allow for fresh fresh produce to come in, as it were. And you can actually get little plugs that go in there. Can even be just put in by your optician.
Really? Is that like day surgery thing? They just kind of...
It's a nothing, James. It's not a big thing at all.
Really?
It's just like, chug, chug, chug. That's it, and we'll charge you this much money. I had those put in, and they did help for a while.
Do they last forever?
No, eventually they will come out.
Kind of like the ear grommets, kind of the same thing. Put them in, they can...
Yeah, they just come out, and it's not like you necessarily even feel them come out or whatever, but you're just they're just not there anymore, and sometimes you can see it. And they worked really, really well.
So you ever thought of getting them redone?
No, do you know what? I've never thought about doing it. So I must have had that done maybe about 12, 13 years ago. I've never thought about it since, but maybe I should, because I often go to the optician saying, I think my vision has changed since having laser, because that can happen because your eye continues to change
So
shape.
that's my fear of laser, is you go and get the laser done, sorts everything out, and then as you start getting older, your vision will obviously degrade, and because I've had the laser, it's now going to degrade in some weird and fantastic way that is a byproduct of the laser. And I've got no science on this. I've read nothing on this. It's just my brain saying, I don't want to chance it.
But all the laser does is it changes the lens at the front of the eye. So it's not going to have knock-on side effects really, because all it's doing is changing the shape to make the light come in through that lens at a better angle in order to then form the image on the back of the retina. So you've got your eye, you've got your lens at the front, the light comes in, it changes the direction through the lens, and then it forms an image, and the image should form on the back of the retina. If it forms behind the retina, or it would form behind the retina, then that's long-sightedness. And if it forms a bit short, so a bit before the retina, that's short-sightedness. And the problem is, as you get older, is that your lens becomes a bit stiffer, it's a bit more difficult to manipulate. And as I say, your eye also changes shape. In pregnancy, that's when a lot of people will have changes in their vision.
Really?
And you should,
I never knew this.
Well, the muscles relax, so the muscles that change the lens relax a little.
All the muscles in a woman's body starts to relax
They do.
to facilitate childbirth.
Yeah. Well done, James. You think you had 2 children. And also,
I watched. I was just an observer. I was in the gallery.
No, that's probably the best place to be.
I told you the story when you did all the prenatal. This got nothing to do with eyes, but we did the prenatal training, and which is useless.
Yeah.
And can you count to 10? That's all you got to be able to do. So skip it. Well, I mean, we met great people through that, and that's all that it was. Is we got lifetime friends, but and so I still remember. I know my wife was probably like 19 hours in labor, right? And at this point, I'm like tired because I go to bed early. And this is stretching through the night.
I feel so sorry for you.
I know. And that was exactly what she said. When I was counting to 10 and I let out a big yawn, that did not go over well.
Well, I mean, it makes you feel better. I was in labour on both occasions, and James was asleep. And I remember being really annoyed. Not for when it got really bad towards the end, but there were portions,
But the sad thing was, all I kept thinking about when we were in the delivery room is they had the bassinet, with the light on, and all I kept looking over there, because I was also getting hungry, is thinking, man, that would be a great place to have garlic bread just sitting there right now. I just kept looking at it going, that's like a garlic bread warmer. I didn't say it out loud because I thought the nurses would also have it on me, but
have I ever told you the story about the baked potato?
No.
So we've really gone off on a tangent, and we should also at some point talk about prenatal classes, because I also
that's
agree.
Our next podcast.
Yeah, that's definitely our next podcast. But very quickly, when I was in labour, I'd not eaten anything for a long time, and I was getting really hungry, and I'd now had an epidural, so I'm a lot more comfortable. And this lady walks in with this lovely baked potato, which is what I'd craved the whole way through pregnancy with the boys.
Sour cream, chives?
No,
just
cheese. Cheese and butter. What more do you want?
What kind of cheese? Just cheddar cheese?
Oh, yeah, grated.
Okay.
Grated cheddar.
Good.
Yeah, mild. And a load of butter and a side salad. And it's coming in, and I'm thinking,
she's in the delivery room with that?
She's bringing it in. I've been there for ages. And
for her or for you?
For me.
Okay.
And I'm like... arms starting to stretch out, thinking, and I didn't realise that everything had got a lot more active down below, and so the midwife was like, no, please take that away. And I still to this day feel so cheated about my baked potato, because then it was everything got going. I didn't know, no one told me. I was just like, come back.
That's funny.
Yeah, so then that night I got a piece of toast, and that was it. So anyway, that's a side point. Pregnancy changes your eyes. You swell more.
So just to recap where we were, we're talking about the fact of laser, which we will, and that came to us as we were talking. What's the name of that gland again?
Lacrimal gland.
Lacrimal gland. And then we were talking a little bit about laser and eye wetness, and then my fear of laser because it's going to change your eye. And then you were just clarifying that your eyes change anyway.
Yeah.
So there's nothing to be scared of.
Yeah, well done. Great recap there, James. So I change all the time.
I got another badge. Last week it was for the notes that I wrote, and now I got one for the recap. This is good.
Well done, James. Yeah, basically medical student now. And when you go for laser, they tell you we can't guarantee 20/20 vision forever. Mm-hmm. And I decided I was so blind that I'd probably never go back to being as bad as that. Yeah. But what I found was it definitely made my eyes more dry. And that's,
so are you always dropping now? You're putting drops in?
I don't always, and that's actually the problem because I feel like my eyes are blurred. And
so it's just liquid. It just needs to be moisture.
Yeah, it basically just needs artificial tears, effectively. Yeah. You can also use your diet to try and manipulate how wet your eyes are by taking lots of good fats. Yeah,
that really works. You're a vegetarian, so do you do fish?
I don't do fish.
No, so you're not going to get any. You're not going to get any mackerel or anything in there.
No, but you've got nuts, seeds, linseed, things like that. Okay. Really healthy fats help. Yeah. And to what extent, I'm not sure, but it has been proven to some extent. And in fact, they really advise you change your diet before you go for the laser treatment.
I've never heard that from anyone. I've known lots of people who maybe they just ignore that part of the instructions.
It's not going to totally change everything completely. It's not a cure, but it's a helping hand.
So I know we all, offhand people always say, carrots and stuff are good for your eyes. And, so
carotene. Yeah.
Carotene. So the idea of diet and eyes is obviously there, but I never really put together that there's a whole bunch of things, talk about naivety, a whole bunch of things that you could be eating and by changing your diet could help with moisture of eyes, could help with eye health.
Let's think about it really, because there's an awful lot now of naturopaths, and we had one of the wellness brothers on, didn't we?
Yes.
Which one did we have?
Right. I think we had Ryan.
I'm not entirely. Yes, it was Ryan. It wasn't Sean. His name is Sean, isn't it? Anyway,
we had Sean and Ryan. Yeah.
Yeah, we had a wellness brother on.
I'm supposed to go. I mean, actually, this has been a long time. This has been a couple of years. I'm supposed to head over to their place and do some more podcasts with them. Good for reminding me.
Yeah, it's okay. That's what I'm here for. Double up his PA.
You should be working at the Wellness Brothers Clinic.
They do some really great stuff because they're really into using diet, a natural resource, to help heal the body. And in fact, a friend of mine, she's very, very much into this holistic style medicine. And she's managed to use her diet to basically calm down her thyroid. She became hyperactive thyroid, and she's managed to use her diet to manipulate her thyroid.
Really?
Yeah, and even the doctors are saying we're not sure how this is working. Now, I don't recommend people do this alone. If they're going to do it, make sure the doctor has said, please, go ahead, try.
Follow up with the doctors so that they know what's going on, so they don't start playing around with medicines and things. And
it's not even just that, James. If you decide you're going to heal yourself, that's great, and there's definitely a place for it. But there is also times when you can't do that entirely, and you should at least be under the watchful eye of someone that can intervene and say, okay, look, you need to take the chemical.
It's like a second opinion. You need someone to say, it's not quite working.
Yeah, exactly.
So this friend who did the thyroid stuff, but they've
Marty Hobby, by the way, she is a wonderful lady, is available for consultations online.
She's here. Is she in the UK?
She used to be in Dubai, now she's in the UK.
Okay. Marty Hobby.
Yeah, she's actually she'd be a great person for a podcast.
I think we'll get her on the Zoom.
She's really into nutrition, diet.
Oh, okay, that sounds like a perfect one. We just got to set up the right time.
Yeah, let's definitely do it. And I think if she heard about my dry eyes, she'd be like, Jenna, you need to be having X, Y, and Z to eat. And, but point is, dry eyes. And the other thing with laser, going back to the laser, is it just changes your vision slightly. It just alters it.
For yours, but you figure, yes, it's altered the vision, it's altered it slightly, and yes, it's going to degrade over time, but it's never going to go back to as bad as it was.
It doesn't necessarily degrade, but there is a high chance of it getting a little bit worse. But yeah, so I've been a happy customer, and I'm glad I did it because I couldn't cope with the eye infections. I couldn't cope with it anymore.
And this is that whole thing. Some people are, are just prone to eye infections. Do we know why? Is it because people are wiping their eyes a lot? I mean, that's one thing that I think this whole pandemic stuff, and so I swore that we were not going to talk pandemic, and we're not. But I want to just skirt on the fringe of the pandemic.
The hygiene aspect.
The hygiene aspect.
Yeah.
And people are wearing masks everywhere. I mean, at work, I have it on all day. I don't take it off. And someone walked by my office the other day and said, James, why do you got your mask on? I said, you know what? I just leave it on. It's just, it is what it is. But I notice people are not touching their faces as much, and they're not biting their nails. And you start to notice when you're watching people without masks, how much people wipe their eyes and touch their face. And we don't do that as much.
Not something that I've subjectively noticed, I guess. But I think it's fair to say people are more aware of hygiene. I think if anything, people are just washing their hands more.
Yeah, there's a lot more of and there's a lot more sanitizer everywhere. I mean, look, I sanitize all this stuff. We've got the hand stuff over there. People are just gooping up all the time. I've never seen so many people gooping up their hands in my life.
Definitely. And, you know, that plays a part definitely in recurrent eye infections is, are you washing your hands before you start trying to mess about with your eyes, washing your hands before you remove contact lenses or place contact lenses in? But it's also...
Do you think people don't wash their hands when they take out contact lenses?
I'd say some people don't. I mean, I've seen people drunk on nights out just go in and throw them. Yeah, just throw them somewhere in the room. But you've also got to consider, are they wearing daily contact lenses, the fresh pair that have come from a sterile environment? Are they wearing monthly contact lenses? Much more likely to get infections, but you know, they have the pros and cons to each of them. Are they washing their hands properly? Is their immune system a little bit low? Do they have dry eyes? That's a great harbour for recurrent infections.
So let's talk a little bit about eye infections, because there's a possibility if you've got contacts that you're gonna head down the eye infection route. But people just generally get. I mean, the other day I had one of these kind of things, and it was like, what's going on? I said to my wife, I said, is my eye red or anything? Because it just felt weird. And I just kind of said, this has got the feeling of an infection coming on. It seemed to work its way out. So for whatever reason, but I was going, and my wife said, that's not going to be good if you got an infection going. And I'm going, I got to go and get that checked. And who needs that?
Well, it's an inconvenience.
It is. It's like, what an inconvenience.
Blooming inconvenience. You know, so...
I'm not going to look good in my TikTok videos. It's like,
you'll have to dance from very, very far away.
Got one eye closed, and I'm going to have to start talking like a pirate. Arr.
Do you remember when you were a child and there were those days that just occasionally you couldn't open your eye because there was so much gunk it stuck together, and usually because of some sort of infection. So the most common infection, and there are various ones, but the most common one is a conjunctivitis.
Conjunctivitis. Everyone's heard that word.
Yeah.
No one knows what it means, but I've got conjunctivitis. And it's like, okay, don't tell me.
Red eyes. So in America, I think they always associate... Yeah. It's always associated with feces getting into the eye. Is that right?
Oh no! Is that how you get conjunctivitis? I have no idea.
It can be, but there are other ways. But I think
feces in the eye. That's someone hasn't washed their hands. Oh, I can do that. I've had a bad toilet wipe, and then they rub their eyes. The next thing you know, you got you're so right.
It's not, but it wasn't me that made that up, James. That was an American. I've seen it on a few films. Like, you got pink eye. Da, da, da. And it was like, oh man, I can't believe.
They're scratching a little bit. Yeah, I was like, we know why. Oh no, that's horrible.
So medically speaking, yes, your eye could appear red because you usually get congestion of the vessels on the eye. Conjunctivitis itself means inflammation of the conjunctiva, which is like sort of covers the eye. You know that itis.
I see. I had no idea. That's why they called it that. That conjunctiva is the cover.
Yeah, it's like the membrane that covers. You know that. Do you know what itis is in medicine?
No.
Right, let's teach some Latin now. So I remember when I first started university, you're given a Latin dictionary, and the first year it's absolutely
learn
battered,
everything. Because
every word you're like, oh my God, what does this mean? And you have to look it up. And then eventually you actually don't realise, you start to understand so much Latin that you can figure something out what it means. So itis means inflammation. So tendinitis, inflammation of the tendons. Let's think of another one.
Tendinitis, tonsillitis.
Tonsillitis, well done, James. Inflammation of the tonsils. There's loads of them, and you'll hear it mentioned very regularly. So conjunctivitis, inflammation, and usually it is from an infective cause, so bacteria, a virus, a fungi, but it could also just be from irritation. So it could be a foreign body that's got in and irritated. Typically, we do actually tend to treat most conjunctivitis with antibiotic drops. That's usually because it is bacterial. So it can come from fecal matter, but if you've not washed your hands properly. But it can also come from something that's on your face that you've wiped in your eye. It could also be, again, contact lenses, just basically putting your hand in your eye, or a foreign body is usually the cause.
Conjunctivitis is pretty common. This is...
That's why children tend to get it more as well, because they're always messing about, aren't they, with those dirty fingers?
Yeah, and then I saw some kids the other day where we were just out somewhere, and two little children just wrestling with each other, and the little girl, she was getting the upper hand on the boy. It was very nice to watch that, and she was rubbing his eyes, and I'm just thinking, I wonder where those children have been playing. Someone's getting an eye infection.
I mean, it's so common, isn't it? And especially in young children. And if it's gunky or oozing, then definitely you're looking at bacteria.
It's that pussy thing in the morning where you can't open your eye thing, and you think, oh, that's the worst.
Yeah, it's not pleasant. I mean, so that's something that's very common. And the other thing that you often get is blepharitis, which is where you get inflammation and basically an infection of the eyelid itself.
I've seen those people.
Yeah, and you have to almost clean the eyelids, and you've got
underneath?
little oil glands. No, just with a cotton wool bud.
Okay, just the top.
And shove it in. You shouldn't be doing this on a day-to-day basis. This is for people that have got the condition, and you need to sort of clean your eye, because it's often a problem with the oil gland. You get sort of dead skin that blocks it, and then you get infection of the gland. That's also quite common, again, contact lens wearers. These people do tend to...
So it's 2 for 2 with contact lenses.
I'm almost terrified to say it, but I used to get loads of infections with my lenses, and I don't think I've had an eye infection since. I've not worn them since 12, 13 years. Just watch, next week I'll come in and my eye will be bright red.
I know that folks love contact lenses, and I know it's a big business, and I know so many people who wear them. I've never worn contact lenses. Never. And honestly, the reason is I don't want to put anything on my eye because I think it's unnatural. And I found that glasses do two things. One, they're a nice fashion statement. Not these. These are just reading glasses. But as a foreign body protector, like if something's blowing, it's not going to blow into my eye. It's going to blow into the glasses first. So I just kind of just the idea of putting something on my eye. Yeah.
It's funny, but my mum also wears glasses every day, and she feels naked without her glasses. And she often says things like, I can't speak on the phone. If someone's calling, I can't speak, I've not got my glasses on yet. What difference does that make? But she's convinced she can't hear properly until she's got her glasses on.
I get that. Yeah. I've been wearing glasses since I was 4. My parents always felt so sorry. But 4-year-old with glasses, I've got pictures of me with glasses at 4. They're on my face like this, held together with tape. Because 4-year-olds destroy them. But they're just a fact of life. I mean, I don't do anything without glasses on.
No, and that's just you, isn't it? Whereas when I wore them, I always felt that I was hiding. I felt like I couldn't wear the earrings I wanted to wear. I couldn't do my eye makeup like I wanted. And I felt like I wasn't dressed in the morning. Yeah. So it's funny how different people feel so differently about their glasses. Yeah. But for me, I'm glad I don't have them. But more so, I'm glad I don't have the infections from the contact lenses. And
what a great thing.
Yeah.
So what's the infection that happens with your eyelid where it gets all...
Yeah, it's not an infection. That's something called ptosis.
Ptosis?
So
that's a nice name.
As a medical student, again, it's drilled into you something called Hormone Syndrome. And it's ptosis, meiosis, and anhydrosis.
Ptosis, meiosis, anhydrosis.
Yeah.
Say that 5 times after you...
Yeah. After a cosmopolitan, So
that's Hormone Syndrome.
Ptosis is where the eyelid droops, and it's usually from a form of nerve damage. It can also happen a lot with...
So Botox would be good for that.
That's just what I would say. No, not good for it. Botox can cause it. Yeah. If you inject somebody too low down, sort of towards their eyebrow, on the outer side of the eyebrow, that can cause the muscles that hold the eye up to sag, basically, and their eyelid it looks like it's sort of coming over the top portion of the eyelid. Looks like it's coming over the eye.
Will it reverse after when the?
Yes, after about 3-4 months.
3 or 4 months. Can you imagine? You walk around looking like you've been in a fight for 3 or 4 months.
Don't go to backstreet cosmetic clinics.
Yeah, exactly. You won't go back to that place. Yeah. It's like, you got to fix it. There's nothing I can do.
There actually isn't really all that much you can do. You have to sit it out. Then the other one is meiosis, where you've got constriction of the pupil. And then you've also got anhydrosis, which is where you have a lack of sweating on that side. And it can be from a number of things.
What do you mean lack of sweating?
Yeah, anhydrosis. You have a lack of sweating on that side of the eye.
Really?
Yeah.
We sweat. Where do we sweat? Like just above the eye?
James, you sweat everywhere.
Yeah, but your eye doesn't sweat.
Everywhere. Have you not had a really hot curry before and got the eye sweats? Come on. When you like have to dab your brow because it's like, whoa, what have I eaten? What chili was this?
Maybe.
I know for a fact I definitely get it, but you actually sweat everywhere, really. You're always releasing sort of water and it's evaporating off, but that will cease to happen around the eye. I always look at the right side of the eye, but it can happen on either eye. It's usually unilateral, and it's from a form of nerve damage, whether it's in the neck, whether it's sort of like an aortic dissection even can sometimes cause it. There's numerous different things.
Okay.
Or it can also be a tumour that's at the tip of the lung as well. So there's a number of things that can cause it, but that's called Hormone Syndrome, and that's not an infection usually. It can be an infection like myasthenia gravis can cause part of the Ptosis, which is where the eye droops, but doesn't cause the other things.
Is Hormone Syndrome something that's fairly common?
No, it's
okay.
It's so uncommon, but
it's rare. As you
every
said, it's
medical
rare
student is told about it from day one, and I don't really know why.
Yeah, that's weird.
Yeah, no, there's loads.
Well, I
of
guess
funky
because it's going to be
things.
that one thing that's going to happen at one point in your life, and you're going to go, I remember med school. Got to direct you.
Yeah, maybe it's because you don't see it very often. They drill it into you so that you are aware when you see what it might mean.
Yeah, because there's going to be a bunch of stuff that's just going to become, the bread and butter of GP's practice. They're going to come in, yep, know what it is, here you go. And then it's like, oh, hold on.
Yeah, there's quite a few of those. You learn some weird and wonderful things that you don't see very often, but everyone knows them. And I don't know how we're doing on time, but there's lots of other more serious things that we can talk about with the eye as well.
We got a bit more time, so let's do it.
Let's do it. So the other one that I think I always try and speak to people about is retinal detachment.
Yes, hear a lot about that.
Retinal detachment and glaucoma. I don't feel like we can talk about the eye and disease of the eye without mentioning those two, because they are the two that are most at risk of causing complete vision loss and not returning. And there are lots of other things that also cause vision loss, like papilledema, where you get sort of inflammation around the nerve of the eye, and that can compress the nerve and cause vision loss. Same with diabetic retinopathy, where you can get small little hemorrhages, so like little bleeding on the back of the retina, again, which is where we actually see is the retina. That's where the vision is formed on the back of our eye. And again, over time, if you're not controlling your blood sugars, this is what can happen. It damages the blood vessels of the eye and it can cause bleeding, and that's how you can lose your sight. But the two more acute ways are, as I say, let's talk about retinal detachment first. So the perfect history for retinal detachment is someone suddenly feels like the sight goes black and it's like a curtain comes down. They often describe a curtain coming down. And what happens is that the retina basically peels away from the back.
Oh.
Yeah, so it almost like sags and often be due from a lack of pressure.
Is there pain
bleeding.
when that happens, or is it not really?
It's not usually. That's not normally a real common thing that people would say is it's painful. It's just
there's no real nerve nerves like that there.
Not really, no.
But you just can't see.
Usually, so something like glaucoma, for instance, that's painful because it's sort of internal to the eye. The retina just literally, people just say it's literally like a cloud, a curtain just comes down. Wow. So it's not usually something where pain is mentioned. Depends on the cause though, James.
Okay.
So sometimes if it is due to sort of irritation or really bad bleeding, maybe there could be, but that's not the typical history. It's not something that is the forefront. It's the fact that everything just goes black and it comes down in this sort of wave fashion. And you don't mess about. That happens, you go straight to the emergency department.
Okay.
If you have
is there a window of time where they can reattach that or do something?
Yeah, you can't. I don't know the actual the number of hours, but the general rule of thumb is you get them into theatre as soon as you can.
Okay.
And the longer it's left, the more chance you have of losing your vision. I remember we picked up a patient once from, I think it was Afghanistan. It was this poor gentleman. It happened in both his eyes, both of them, and we had to put pads over his eyes. To basically stop him from trying to move his eyes, because the more he moved his eyes, when your eyes are open, and you naturally can't help but try and look around yourself. When that happens, you're more likely to interrupt that retina further by the movement of the eyeball. So we had to cover his eyes, and he had this quite long flight to get him back I can't remember what country he went to now, but we had to basically try and get him into theatre, and there was nothing available where he was. And we were all quite concerned because every hour he spent on that aircraft was another hour that he hadn't had the surgery to try and intervene. And it was awful. He was sort of saying, please pray for me, pray for my eyes, pray I can see my children again. It was awful.
Ooh, okay.
Yeah.
And I've heard people getting detached retinas from, a bad fall in the schoolyard, playing sports. I mean, are some people more predisposed to getting this, or it's just luck of the draw?
There'll definitely be a genetic predisposition, but also, trauma definitely is something that can. I've never really had someone just falling over and it happening, but it could definitely happen more so for something like bungee jumping and things like that that mess about with the pressure of the eye. But often it's just random. It can just be just random, and the people didn't even know that it was going to happen to them, and it just suddenly happens on that day. More common as you get older, though, as well. Okay,
and if you do get into theatre, if you do get into surgery, it is something that can be fixed.
If you get there soon.
Okay.
Yeah, so the longer you leave it, the less likely you are. And obviously, if the retina won't reattach properly to the back of the eye and it's not fixed very, very quickly, then sadly, you can lose vision in that eye. And it's usually unilateral. It's usually one eye that's affected. And then the other one we should definitely discuss is glaucoma.
Yes.
I feel like that word is used a lot.
It's used tons, and I have no idea about, I hear, my grandmother's got glaucoma, or so-and-so has glaucoma. It's like, oh, yeah, okay. Hear the word. Said, okay, so tell me what glaucoma is. Something with the eyes. Yeah, you're there. What about the eyes? I don't know. I really don't know.
Well, it's a pressure problem, and it's an increase of pressure in the eye. And there is closed angle glaucoma and open angle glaucoma.
That's the test they do when you go to the optometrist, where they blow the eye on your eyeball.
Yes.
They're testing for the eye pressure.
Yeah. But it's really important that the pressure's inside somebody's eyes, because too little can cause retinal detachment. Or you can get sort of like lots of floaters and things like that in your eye, which you tend to get more as you get older anyway.
Floaters. I get those every now and then.
Do you?
They're weird.
They are weird.
They are weird. It's like, what is that?
Happens more as you get older.
There we go. So you're suggesting I'm old, right? Okay.
No, I get them as well. And it's as the jelly in your eye sometimes turns to liquid. And as you get older, then you can start to see like little strands in your eye.
Yeah, it's weird.
Yeah, if you get too many floaters, then you should be going and just getting pressures checked.
Yeah.
But for glaucoma, you have an increased pressure, and it can either happen slowly, and that is open angle glaucoma. So it happens slowly, and basically where the fluid exits your eye, and again, because you're always making more fluid, as the fluid's exiting your eye.
So the eye's full of fluid, right?
Yeah, the eye is. It's full of fluid because it needs to, for the light to travel through, it needs to be a clear substance. And so you're always replenishing that fluid. But if slowly the vessel where the liquid is from your eye is exiting starts to get closed up, like it has small deposits over time, and these can even be like cholesterol deposits, like we were talking about the other day.
For strokes, that was the stroke shot.
Yeah. But this can be like from various different reasons. It starts to close. People will gradually start to lose their vision and not even really realise it because it happens so slowly. And so, that's a chronic process, which is why they will check your pressures. Is this happening? Okay. You don't realise the pressure's building up in your eye. And for closed angle glaucoma, that's an acute onset. So it happens all of a sudden. And basically what happens is that a portion of the eye kind of folds a little bit, and it means that water can't escape from your eye. And that is a medical emergency. People will often feel sick, nauseous, they'll have a terrible headache, there will be definitely pain in the eye. And so you'll often sort of see them holding their eye and saying, I just don't feel well, I've got a terrible headache and I can't see properly. And again, it's a medical emergency, it's straight to A&E. And if it's got soon, it can be fixed. Otherwise, it will cause compression of the nerve. And
then you're done for.
Yeah, well, not necessarily done for, James, but your eyesight will be severely impaired going forward if you have any at all.
No, we don't want that.
No, I mean, it's terrible. It's a terrible thing to happen.
So with glaucoma, again, regular optometrist appointments, checking for the pressures could be a good thing.
It's often genetic as well. So that tends to be more so genetic. So if you have a first degree relative that has had glaucoma,
and it could be male, your father, your mother, grandmother, grandfather, doesn't matter who.
No, first degree. So it'd be your mother, father, or sister, brother.
Okay.
And if you have one of those, then I believe in the UK, you are actually entitled to free optometry appointments.
Really?
I'm
Okay.
sure that was the case, yeah. Certainly was years ago. It's been a while since I've practiced in the UK, so I can't remember, but yeah, that used to be the case. And yes, we should all be going to the optician. And I was actually sat here thinking, when was the last time I went to the optician?
I know absolutely that I need to go to the optician. It's been over 2 years because I was thinking, I want to order some new glasses. And they said, yeah, but you need an updated prescription.
Yeah.
And so I gotta do that.
I think for adults, it's every 12 months. You should really be going to the optician.
So I'm well over the expiry period here for that. And that's not good.
No, it's not good, James.
It's one of those things that we just don't, it's just like, I'll just do it later.
Well, we had a chat before we started recording, didn't we, about life administration? And
Yes.
I feel like...
Life administration.
I feel like we
that
should
word.
have a 4-day week and then a life admin day.
That last day is the life admin day. And I do use
It'd be the busiest.
Yeah, it would be. And I was actually thinking, life administration, I was thinking, one of these things, I got to use that Friday of the week and go and get an eye checkup and maybe a few other things along the way. Well, I was actually thinking maybe I can back to back a few things that I've just haven't gone and done. So
yeah, well, looking after your eye health is important, and it's funny because we just don't think about it.
Yeah.
How crucial are our eyes, and we don't really think about the health of them. And the fundamentals of eye health actually come back to diet, exercise, just general lifestyle.
Yeah.
We don't realise.
Would you never attach diet and exercise to eyes?
Yeah. Yeah, frequently, if you're diabetic, eyesight is something you would really worry about.
Right.
And yeah, like again, people with thyroid disease, the eyesight is something you really worry about. So there's a lot of medical problems that have impact on your sight.
There we go. Hey, this has been a lot of fun, Jenna. We've learned a lot, and we've opened up a lot of doors for people to go and explore more, ask more questions. But there's a lot going on with your eyes. Think and think and think about what you're doing to preserve that eyesight and keep it working. We know where we're going on our next podcast. We're going to talk all sorts of...
We were talking about prenatal classes,
Prenatal classes. We're going to just talk about
do
having
it.
babies and more. It's going to be fun. And if you're wondering what you're listening to, it's Doc Talk with Dr. Jenna Burton. I'm James Pikeway, coming to you from the Rove Hotel downtown Dubai. We'll do it all again really, really soon. So long for now. Hey, that was great.
We know more about eyes.
Whew. Where do you have to go next? Where's your next stop?
I've got to go to try and get home for 11 because I'm talking to Mediclinic.
Got to run. Oh,
Yeah.
you might go work for the Mediclinic?
Well, they've asked me to. I met with the CEO.